Good evening, everyone. A warm welcome to one and all present here. And it's a really pleasure for me to introduce uh, our today's speaker, Dr. Suchismita, who has more than 20 years of experience working in the field of autism and developmental disorders. She is a special educator and behavioral therapist who has worked very closely with children, parents, professionals over the all these 20 years. She is the founder and technical director of Perseverance School, where many parents and children are supported in building, meaningful learning and independence through a structured approach. She is also the managing trustee of Pregnia Charitable Trust, where she is actively involved in many areas like early intervention, special education, vocational training, and spreading awareness as well. And what I personally appreciate and admire about her is her work that she has a very clear understanding of how children actually learn. And that is what she's going to explain today very clearly for everyone here. She's always focuses on how moving beyond just matching or repetition towards real understanding and independence her focus will be. And her sections are very practical and easy to connect, and it will be based on her strong experience and knowledge, and I'm very sure that you will be able to relate very easily in this session. Today's topic is from matching to meaning, where she truly reflects her approach and philosophy, and I'm very happy, and I'm sure along with me all the participants are here are very happy and honored to have here ma'am with us today. And so let's all welcome her together, Dr. Sujismita Das. Over to you, ma'am.
Thank you, Steffi, for such generous and warm welcome. Means a lot. Uh, Good afternoon, everyone. Today we are going to discuss a topic that appears simple on the surface, but in practice, it is one of the most misunderstood areas in autism intervention and in special education. So, we are today, as you have joined for this webinar, you know that we are going to talk about from matching to meaning. And this session is about understanding why many children in autism appear to be learning, but in reality, they are not developing the true academic readiness. It is also about understanding why many children can recite, repeat, label, or respond in therapy settings, but yet struggle on a regular life functionality and to implement their knowledge meaningfully. A child saying A to Z is not enough. Uh, at the beginning of the, once we get the diagnosis, and then eventually we see our child has learned to say A to Z, reciting, singing, and child is saying 1 to 20, and child is repeating colors, shapes, body parts, or naming the objects here and there is not enough. As I say, it's not enough. The real question is, does the child understand? Can the child discriminate? Can the child generalize? Can the child apply learning meaningfully across situations? And if the child is not doing all of these, I think that's where we need to change our perspective and understanding. So today's session will help you understand the difference between rote output and meaningful learning. How children get stuck, how professionals unintentionally create this problem, how we can build a better, more scientific, more ethical teaching process. That's where we are going to talk about today. So let's begin. So, why your child is not progressing and what to do next? Many children with autism begin by learning through structure, repetition, cues, visual supports, and behavioral teaching methods. Now, there is nothing wrong with that. In fact, the structure is often essential, but structure is only useful when it leads somewhere. If the structure only produces repetition, then we have created dependency, not learning. The goal is for the child to understand that a word refers to something, that a concept has properties, Suppose when we say ball, ball is not an abstract thing. Ball is related to a ball. Now if I tell you ball, and if I tell you to close your eyes and think about a ball, you can visualize it. That means that word has a meaning to you, it has relevance to you, and it's a concept. Now the learning applies in the real world, and that academics are not isolated drills but part of thinking. If we are not able to build that, that's where the challenges we face, and we experience that okay, child is able to say so many things, able to do so much, but real life implementation is missing. I'll definitely will come to the remedial part, but let us understand what happens first. Now the goal is for the child to understand the meaning of the word. Now, when I say use the word meaning, I want you to interpret it in a broader way. Meaning includes understanding, functional relevance, concept formation, discrimination, generalization, independent response, and the flexible use. As professionals, if you're working as professional, then your work is not to produce trained responses. Your work is to build meaningful learning pathways. And if you're a parent, you have to see where your child stands right now, what are the words child has, and how meaningfully the child can use those words in a different areas on a daily life. That's important, and we need to, so we have to understand that once we are able to do that, we are putting a meaning to the uh, uh, sorry, Steffi, you have a feedback?
Uh, Maybe because of the fan, the volume is very low.
Achha, just a minute, give me a second.
Yes.
Is this better now? Is this better now?
Yes, ma'am. Yes.
Okay. Bangalore is not anymore that cold. Okay. I was saying that when we put that word, uh, uh, a meaning, so the word gets a structure, gets a property. Now, child knows bottle. If you say bottle, bottle, child can say bottle. But when you put a bottle in front and say bottle, or give me the bottle, where is the bottle? So the word bottle gets a property, a structure. So let's understand the reality. This slide basically captures one of the most frequent concerns raised by parents and one of the most important clinical observations a professional must learn to interpret. Now, a parent says, my child knows A to Z but cannot identify letters. Let me repeat this statement. My child knows A to Z but cannot identify letters. Now, what does this actually mean? It usually means the child has learned a verbal sequence. A, B, C, D, E, F, G. Child can sing, say, but the alphabet has been memorized as an auditory chain. Now, the child may be able to sing it, recite it, say it on cue. You say A, child says B, you say C, child says D. But recitation is not the same as recognition. Recognition is not the same as discrimination. And the discrimination is not the same as literacy. Similarly, a parent says he counts but doesn't understand. Again, the child has probably acquired a rote number sequence, but does the child understand quantity? Does the child know that 3 means 3 objects? When I say 3, then I should have 3, 1, 2, 3 is 3. Or I say give me 1, child is able to give me 1. Whether that is happening or not, that's Very important. Now, can the child match the number to the quantity? Can the child compare more or less? That I have 5 here, I have 2 here, so 5 is more, 2 is less. Can the child identify that? That's also very important. Can the child respond when the quantity is presented in a different arrangements? If not, then counting is still only verbal behavior, not a number concept. Now consider the third sentence. She repeats but don't use. Very often as professional we get to hear that. Now in this, a clinically very important that we understand these things. Many children with autism, they show repetition. Echo the responses, scripts, the thing, memorized answers. How are you? I'm fine. How are you? I'm fine. The day she's having high fever, if you ask how are you, she will say I'm fine. So uh, these are all trained labels. Now our child may answer what is your name correctly in therapy, but still be unable to use it in a functionally when you are outside, you are taking your child to a family gathering, some function, some common place. There they don't answer the question. Why does this happen? So this tells us that the response exists. The child is able to answer, but the communicative understanding is incomplete. In a therapy setting, when the child is going for a therapy, sitting there for 1 hour, 2 hours, 4 hours, depending on definitely the program structure, therapists say initially, what is your name? Suppose I am the child, therapist prompt me to say Shuchi. So I'll say Shuchi. And next, eventually I master the skill, and eventually when the therapist will ask me what is your name, I'll say Shuchi. But the same thing when I go to a family gathering, they ask, hi. Normally when we see a small child, we say, oh, hi, how are you? What's your name? That time I don't say it. So you understand the difference. Child is learning. The child has learned to answer a typical question, but the functionality of the language is missing. So when we hear anyone says these things, we must not label the child as not ready, not able to, not cognitive. Very often as professionals we tend to do that, okay, or even parents also at times, they say, oh no, she is not able to learn labeling, she is not able to use the languages. No, so we must examine the instructional structure, what is happening, why. That is the reason. This is not ability, this is the structure what is important. Child is learning, we cannot say child is not learning, child is not ready. But if there is no structure in that learning, then this kind of situations we face, and that's very, I think if I meet 50 parents at Perseverance, at least 45 parents comes with this. And that's why I have chosen this topic today. I felt that whatever best way we can pass on this knowledge to the parent to understand, don't just be happy with the fact that child is able to recite ABCD. Okay. Now let's understand. Steffi, next slide, please. So how to identify this professionally? As a therapist or educator, you must check, can the child respond only in one format or in multiple formats? Can the child identify when the item changes in size, color, orientation, or the context? Can the child respond without exact prompting? Can the child use the skill outside the teaching table? Can the child connect the response to meaning? And if the answer is no, you are likely looking at a structurally narrow skills, which needs more development. So in order to do that, there are do's and don'ts. First, let's talk about the do's. Do analyze the skill beyond surface output, what we are seeing superficially from the top. Do check for receptive understanding. Do test generalization. Do vary material and instruction. Do look for the concept evidence. These are the major things which will help you to understand it more clearly. The don'ts, I would say, do not assume recitation means understanding. Do not confuse compliance with cognition. Do not move ahead academically just because the child is responding. Do not reassure parents based on only on tabletop performances. Do not teach labels without building the concept. Okay? This is the doorway to the rest of the training. It teaches us that question are these the pointers what I have mentioned. These are important. These are the things what we need to monitor closely. Whether we are professional or parent, we need to have clear understanding of where the child stands. Now let's talk about the Plato phase. Uh, Basically, what happens? The learning is happening. As I said, when the child is able to name the object, tell you able to tell you A to Z, uh, tell you the colors from the rote learning, the learning is happening. It's not the child is not learning, but meaning is missing. And this is where the child gets stuck. Now, the Plato phase is one of the most clinically significant stage in intervention. And why do I call it Plato? Because professionals and parents often report that the child is doing many things, yet progress feels flat. So, if you remember, how does a Plato look? Geography, let's go back to our geography book. So, it goes up, then there's a flat, and then it comes down, right? So, it looks like a table. Why that happens? The child is not where they were 6 months ago, but they are also not moving forward. They are not moving forward to meaningful independence. So, this phase is very common, roughly in the age between 3 to 8 years, although it can appear earlier or later depending on the developmental profile of the child or intervention history. Now, what does the Plato look like actually? The child may be able to sit, that's a basic requirement, right, when we go for therapy sessions. Attend for short periods, match identical items, repeat sounds or words, follow familiar routines, label memorized content, respond to learned questions, do label tasks. Uh, then, but what happens when they are doing all of these? The child may still struggle with new instruction, real comparison, real comprehension, flexible use of language, functional academics, generalization, spontaneous use of the knowledge what they are gaining, concept transfer. They might struggle with all of these. So from outside the child appears to be learning, but from inside the developmental structure is incomplete. So please understand why children get stuck here, because children get stuck here when foundational learning system are not built deeply enough. Whatever they are learning at a surface level, they are not going deep into that. So they may have been taught to respond, but not to think. They may have learned stimulus response pattern, like if you tell this, I'll do this, if you tell me to do this, I'll do that, but not concept formation. They may have been taught through excessive prompting, leading to prompt dependency, or they may have been rushed into academics before receptive understanding and discriminations were stable. If that happens, then to build the learning carefully, we need to have a stimulus control, errorless learning when required, prompt feeding, discrimination training, reinforcement, shaping, task analysis, generalization programming, maintenance planning, and data-based evidence, basically the database decision making. When you have all this data, based on that, you know where exactly your child stands, and from there, you make a conscious decision. But whatever I was talking about, let's go back. I think I spoke about prompt feeding, errorless teaching, stimulus control, discrimination training, shaping, uh, generalization. These are all tools to build the real learning. If you are, whatever you are teaching, if your teaching has not gone through these steps, if you have not given the child enough opportunity to repeat or explore the learning in different environment, in different settings, then the performance will be superficial. But once we take the learning through these, then it's not a superficial performance at all. It stays with the child. Then we have to remember what are the do's. Do identify the plateau early. That, okay, the progress is happening and now there's no real life implementation is happening. That's, you have to identify whether you are a professional or a parent. Do review learning quality, not just learning quantity. Ma'am, last term also the child was learning this, and this term also child is learning the same thing. Target might be same, but see the areas. Perhaps initially when you looked at those targets, the child was matching, sorting. But now, perhaps child is generalizing that concept. Perhaps child is working on the recalling part. So you have to look at the learning areas, not the quantity, it's the quality. Do revisit foundations if needed. And when I say this, I mean that if you think there are steps which you have skipped while going forward, please go back and work on those, because it's very important for a child to take each and every step to reach to the end, so that whatever they learn, at least that is rock solid. Imagine you went to school, you studied grade 1, then immediately you were put to grade 5, and then immediately after to grade 7, and then 10th exam. You will pass. Okay? But your learning will be incomplete. You will know certain things, you will not know certain things. So it's very important when you are climbing up the steps, you get on to the every step, so that whatever, when you reach your destination, there is no gap behind, because these gaps will show up later on, because the targets are very interdependent. If you now skip sorting here, and later on when you try to teach a child that, okay, this is a policeman, this is a doctor, and I have set of things, tell me what all a policeman uses and what all a doctor uses, just because you skip sorting, child won't be able to relate to that. So that's why it's important that we follow the steps. Do examine the prompt dependency. How much prompt dependent your child is. Is child able to, are you able to feed the prompt, or your therapist is able to feed the prompt? If the prompt feeding is not happening, discrimination will become weak. Lack of generalization will come, and for everything child will look for help. If you are able to connect to these, but I think this is the high time you need to have a word with your therapist, with the school, with the professionals. As a therapist, as a professional, you should explain to the parent how exactly a plateau looks like. And as a parent, you need to observe the pattern closely and ask your therapist what exactly is happening with the child. Moving on to the next slide. It says rote versus meaning. And this is the heart of this session. Let us separate these two clearly. What is rote learning? The rote learning is by repetition without full conceptual understanding. In autism, rote learning often appears as repeating words, reciting sequence, answering memorized questions, labeling trained pictures, performing only in familiar format, responding only with prompts, and failing when context changes. Rote learning is not bad, not always bad. In some cases, rote learning is a stepping stone. A child may first repeat before understanding. That's very, very normal and acceptable. A child may first respond with prompts before becoming independent. That's also absolutely fine. Now, the problem is not that rote learning occurs. The problem is when teaching stops there. Child is saying, okay, done. Child has mastered it. We stop there. Now, let's understand what is meaningful learning. Meaningful learning happens when the child connects to the response, to a concept, and can use it in a flexible, functional way. Meaningful learning includes true receptive understanding. It's very, very important. Just keep this line in your mind, whether you're a professional or a parent. Please understand, true receptive understanding is the first step on the ladder. Then the stable discrimination. I have water in bottle, I have water in glass, but to drink from the bottle, I have to open and drink from to drink from the glass, I can just drink. So we should have that stable discrimination, understanding. Generalization across materials and settings. Response flexibility and the application of that. That's very, very important. Now, for example, if a child knows apple meaningfully, and the child should be able to identify an apple among choices. There are many things, and if I say, give me the apple, where's the apple? Child should be able to pick up the apple and give it to me. Recognize different types of apples. There can be green apple, there can be red apple. Child should be able to recognize that. Child should be able to point to apple in a book or in real life. Respond when the instruction changes. Now, if I say match apple to apple, if it's I'm doing it with a object or the real life fruit or those plastic toys of apple, basically the 3D object, child should be able to take the apple and match to the apple. Name it if expressive skill permits. If the child is having, child is verbal and child is able to say the words, then I ask, what is this? What do you see? Child should be able to say apple. Now the concept of apple, child is able to connect to real situation like eating, buying, sorting fruit, all of that. And that is meaning. Rote learning is dangerous when mistaken for readiness. If a professionals mistake rote performance for readiness, they may place children into academic demands too early. Then the child, of course, cannot cope, avoid, resist, or become prompt dependent. And definitely as a parent, you get anxious. You think, I don't know what to do. If this is the level of my child, what should be done next? And we completely depend on the professionals. And if there is no clarity in the process, then comes the ambiguity. Now, school perceives the child as incapable because child is not performing in school. But in reality, child may simply have been advanced or put into the struggle without the real concept. And that's, in our professional language, we call gap in development. What are the clinical indicators? How will you understand the rote learning? Now, child respond only to one therapist. Parents at times in our settings also get upset when we change the therapist. We say, okay, we need to work on more generalization. No, ma'am, the child was way too settled with that. Child loves his teacher. Please don't change. It's dangerous to do that. Please trust us as professional. Please understand your child should work with different people. If you just because child is too compliant to one person and you continue to do that, the generalization will become a bigger challenge in child's life. And it's not for you, not for me, it's for the child. Okay? Now child responds only with exact wording. So for example, if you say, how are you? Child will say, I'm fine. If you say, how do you do? No response. How do you feel today? No response to that. So child only respond to the exact wording when we say, how are you? Now, the other indicators are like the child is not able to answer when one feature changes. Child gives the same answer to different questions. Child shows no spontaneous or flexible use of the knowledge what the child has built. Now, please understand in this scenario, do use rote as entry point. If necessary, do use rote as entry point, but plan movement beyond it. You have to have a clear plan for the child, what's next. Do build receptive discrimination and application. Do observe how the child uses the skill, not only whether the child says it. Now, example, child knows red. Red is consistent. Child is able to, now you have worked on the receptive understanding. Child is able to identify red in regular object. Now there is you take him to the shop and he points finger to a shelf. Now you see cars are there. There are many cars. Now that's your opportunity to create the generalization. That's child's skill to implement, to say, hi. Okay. Child's point to say red car. Or if the child is not able to say red, the car, child should be able to say red. So you know that from all the cars, child is able to identify red. Do collect data. Do collect data on independence and generalization. When you do that, you have clarity what exactly and how your child is progressing. If you don't collect data, if you don't have data, if you go to a professional and say that my child is able to do this, trust me, to do the baseline, they will take at least 15 days to 1 month to get the clearer picture. So if you have the data, you can share it with the professionals, and it's much easier for us to look into that data, and we will ask questions whatever we need to, but there is a clear understanding of the child. Let's understand why children get stuck. Now, this slide basically summarizes the 4 biggest errors that derail the true readiness. Number 1, learning without understanding. This happens when we teach responses without building concept. For example, a child is taught to say colors without learning to sort. Child is taught to say colors without to identify, without to compare. And now find those colors in natural material. Now child has learned to identify or say green, suppose. Now when you go out, the leaves are green, maybe someone wearing a green t-shirt, or maybe you have curtain which is green, but child don't find those colors in natural material. Now child can say red, blue, green, but these words are weakly connected to actual concept of the environment. So this is learning without understanding. Second thing is the prompt dependency. Now prompt dependency is one of the most common instructional error in autism programs, most of the cases, because it occurs when the child learns to wait for help instead of learning to respond independently. I would repeat my sentence once more. It occurs when the child learns to wait for help instead of learning to respond independently. Child is ready to wait for your help. So waiting is a big challenge, right, in our children. Child is ready to wait. You hold my hand, point it, or you give me the word, do the lip movement. So see, the child has learned to wait. But what we want the independent response. That's where they miss out. Now this can happen because prompts are too strong, faded too slowly, or used automatically without analysis, without understanding whether this kind of prompt works for this child or not, whether the child is looking toward that prompt or not. As a professional, as parent, we have to observe these things. Once we are able to identify these, it becomes much easier for us. Now, a prompt dependent child may appear successful in therapy because child is prompting, I'm fading, I'm somewhat fading, or I'm using another prompt level for the child to respond, but fail in independent condition. And this makes progress look better than it is. The third point is no progression. Sometimes professionals teach the same level for too long. The child keeps matching identical pictures, identify the same set, or repeating the same labels. When the professionals are noting it down, taking the data down, it might look very, very stable. But the program does not evolve. Now, learning becomes trapped in maintenance without expansion. Continuously, you are maintaining that target, continuously, you are doing the same thing over and over again, and there is no progress from there. So, of course, it's stable. It's yes, 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 yes. Tick, 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 tick. But is the child progressing? It's like you have got the nice balance, you are standing on the step stool and dancing nicely on the one step. Balance is wonderful. You have left the hand, you're standing there and like, okay. But you have to take the next step. Okay, that's where we talk about no progression. The next one is no generalization. No generalization means the skill transfers across people, places, materials, instructions, and naturally occurring in context. Suppose you have taught a child to identify animals. You have done sorting, you have done matching, you have done receptive, and in that, cow is the favorite animal of the child. Now you have gone on a drive somewhere, and suddenly child sees a cow and say cow. Or you have gone to a pet park or farm with your family. You get down and you say, oh hi Siddharth, where's the cow? And suddenly child looks at the cow. The moment you say, that's generalization. That's learning. So without generalization, child may only know the skill in the training frame. But real life use, context will be missing. Now, please understand when to suspect these issues. Suspect them when a child is doing well in a session but poorly in a daily life. Suspect them when parents report that child does not use the skill at home. Suspect them when only one therapist can get the correct response. Suspect them when mastery is achieved on paper but not in function. So when this thing happens, we know those 4 pillars are present and things are not happening. Then what should we do? Then we do plan for independence from the beginning. Do varied SD. Do not only say varies, point. Don't use one SD every time. Use your material strategically. When parents come and ask me, ma'am, for OT, what all should I buy at home? I say nothing. Don't buy anything. Use your regular life things. Your kitchen is the best OT setup you can use for your child. So you have to use materials strategically. You have to use varied instruction. You have to feed prompt systematically. For that, you have to have clear understanding of prompt hierarchy, when to use what kind of prompt and when to fade it out. That clarity you should have. Do progress targets once foundation is stable. If the foundation is not stable, do not move forward. Do include real life application. Okay? What are the don'ts? Do not overprompt. Do not freeze targets at one level. Do not make table mastery as real life mastery. That when the child is able to do things on the tabletop, the table mastery is, don't consider it as real life mastery. Once especially at Perseverance, what we do, if the child has mastered on tabletop, we move it to the NET, natural environment training. So the generalization happens. And if that's where child is able to give you independent responses, that's where we understand that yes, and decide, okay, now we need to take a new target. Till then, do not move. Okay? What can you do? What you can do, start doing in order to help the child. Now, give choices to build discrimination. For the professional audience, please listen carefully. This slide is not only an advice, this is an instructional principle. For parents, this means do not show only one item and ask the child to respond. Always give 2 or more options, so the child has to look, think, compare and choose. If I hold this and teach you, what is this? What is this? Someone please reply. What is this?
Glass of water.
Right, it's a glass. Now, if I ask you, what is this?
A bottle.
Right. Now, I place both together and I say, give me water. Now, see, both are water. Both has water in it. So, it's difficult for child, or whatever child gives, I'll say, oh, thank you. But if I say, give me glass, child has to identify from these two things which one is glass. And when the child is able to do that, that's when the learning has happened. Thanks for the response. So always give 2 or more options, so the child has to look and use the brain and respond to that. Now teach one concept at a time. Children with autism often benefits from reduced cognitive load and clear instructional focus. Teaching too many things at once can create confusion, can create prompt dependency, can create shallow learning and poor retention. Now suppose if you have Bengali audience, please do not respond. Now if I show you multiple things, now I say, what is this? And say, okay, this is angti. Angti, okay? What is this? Angti. Eta ki? Ghori. Ghori. Now, I am teaching, why I'm doing it in Bengali, because English, of course, you understand, you might not be able to connect it very well. Now, after some time, if I forget it, I'll continue my session and I'll come back to this. What is this? Tell me in Bengali, what is this? You might be able to, might not be able to. Okay? Auntie. Now, the point over here is, if you take too many targets, now if I, similar way, if I keep teaching you things in Bengali, a couple of 5, 6 words, and I'll say, okay, try to remember, I'll come back and ask you by the end of the session, being a neurotypical adult, until unless you note it down, you won't be able to answer it. Half of it at least. So imagine a child who is just starting to learn, you put too many targets, and then you keep teaching, then you keep prompting. What will happen to the child? Child's brain will stop taking it. Now suddenly if I decide, okay, now let's enough of English, let's start the session in Bengali. Now on I'm going to talk in Bengali only. What will you guys do? Either you will drop or run off, or you will put me on mute and do whatever you want to do. Your brain will shut. Initially perhaps you will try to understand a couple of words, but eventually you will give up. The similar thing happens to the child also. So teaching one concept, please understand, when I say one concept, I don't mean take only one target. I don't mean that always you have to do that. You have to take only one target forever. No. Teaching one concept at a time does not mean being rigid forever. It means initial clarity. So when you are teaching, suppose you are starting, your child has just started to identify, and you are introducing receptive targets. When you are introducing the receptive targets, you wish to, from category, one category, take one target. Once a concept is established, the variation, expansion should follow. Now, for example, when introducing fruits, you may start with 1 or 2 clearly contrasted fruits. You will not take a basket picture, you will not take 6 mixed items and with multiple demands. Steffi, can I see the flashcard picture, please? Now, this fruit, you see, there's an apple, there's a banana. Now, my target here is to teach apple. And we say point apple. And this is for your understanding, I have put in one picture, but definitely you will have either the object. For younger learners, I prefer 3D objects, then move on to 2D. So you have, or the real life, fruits. Say, give me apple. Where's the apple? Keep the apple. Bring the apple. So you are using multiple instruction, but your target is one. That's important. Okay? Check understanding, not repetition. Where the child is, because initially you are, when you say keep the apple, you are perhaps pointing at the place where you expect the child to keep. So you have to look at it clearly, where the child is able to understand that when you say keep, the child is able to relate that word keep with the action and with the object. So this is critical. Do not ask only what is this. A child may label without understanding. If you are using only one sentence, what is this? Child will name the object. Now, the child is labeling without understanding. Instead, what all can we ask? So we can use the multiple response format. Give, show, find, match, sort, identify by feature, give me something that is red, and then later label the object. So child has learned to show, give, find, match, all of that, and then, and identifying the color also. Then when you say, what is this? It's apple. And this is how you test the concept depth. Use real objects. Real objects build stronger meaning. You will not see, I don't think any of the professionals use animated pictures for our children. Even when we are using flashcards, you will see we use clear, real picture of those objects. It's not that mouse is Mickey Mouse. Okay? So it's very important that you use build, when you use the real object, it builds the stronger meaning than the picture alone, especially at a very early stage. Now, if you're teaching cup, spoon, apple, shoe, toothbrush, use actual items. Of course, for the animal, you cannot bring the real animals. For those, we have to use the real pictures, or the toys what we get, we can start with those. Pictures are very useful, but meaning should not begin and end on cards. Child is fut labeling the animals in a flashcard. When they are seeing outside a dog, I don't know. They are seeing a cat. So the give choices to build discrimination. Child should be able to identify a dog in presence of a lion, a cow, a donkey. Every time consistently in presence of other card, child should be able to identify the dog, if dog is your target. Now, when we are giving these choices, we are building the discrimination, and when the child is able to learn through that discrimination, that learning stays with the child. Discrimination is the ability to notice relevant differences. For example, I have a remote here. I have one more remote here. Both are remote? Can you guess this remote is for what? Someone please respond.
For your television?
Yeah, right. And this?
Could be your home theater or your DTH.
Right. So now you understand. Now you have your understanding. You didn't say this is for DTH. You didn't say this is for the TV. For obvious reasons, because you have looked at the features. You understand it has got the numbers, and okay, in the past perhaps you have seen similar remote. From there you have built your learning. Same for this. Though both are remote, you are able to discriminate between these two, and you understand the purpose or the function of these two things. So, discrimination is the ability to notice relevant differences and respond correctly. If you always present only one item, single item, child may not truly discriminate. The child may simply respond because there is no competing stimulus. I don't know what's the other thing, right? Now I have water. If I have a glass of juice, these are contrast, competing. So child pointing at juice glass, and you say, okay, you want water. Child will reject, right? Will ask for the other thing. And when you try to give, that child will drink. Now that's your opportunity to work on that's the stimulus. So you have, on that stimuli, in presence of these two, there's a competition between the stimuluses, and child chooses between those two. And that helps to develop the learning, develop the discrimination. These choices create learning pressure in a good way. They require the child to attend, compare, and then select. What are the do's in this situation? Do begin with clarity and contrast. Do use multiple response formats. Do move from concrete to representational carefully. Do present meaningful choices. That helps the child. Do not overuse flashcards as the only teaching medium. Do not present single item for too long. Do not rely on intraverbal style or labeling based teaching. When I say intraverbal, is the recalling. Do not assume a name, the item is a known item, right? A small example. Now, So basically, if you look at this slide demonstrates the instructional sequence. Why say apple? Why say apple is not enough. Say apple mainly checks verbal imitation or expressive retrieval. It does not tell you whether the child truly understands the object. For some children, it may even evoke echolalia or trained response. Like if you whatever you ask, child says apple. Okay? Now what is the better sequence to teach a child? First, give apple. This checks receptive understanding and discrimination among choices. Then, where is apple? This allows pointing or orienting responses. Still receptive, but often easier for some learners, right? Then, what is this? This checks expressive naming, but now on the basis of concept, not only repetition. Because we have done the receptive understanding, developed the receptive understanding already. Now, this sequence is powerful because it respects developmental order. It moves from understanding towards expression. And when I say that, if you remember a neurotypical child, when they are born, and suppose they started crawling, they started other, they have achieved the other milestones. What happens? Most of the parents, I think the first toy we buy, ball, right? And when they crawl and they go to the ball, I say, okay, go get the ball, get the ball. Child crawls and gets the ball or reaches the ball. After some time, child takes the ball and say, ball, right? The speech comes, child is able to name the object. Now, the next is, by then child knows how to play with the ball, or you have played with the ball. So ball is very common thing in his environment or her environment. If the ball is missing, child looks for ball. So that means child is able to recall from the brain. So please understand, this is entire learning, the developmental order moves from understanding towards the expression, and that's how we should teach. We shouldn't skip or add any steps to it. Now, in autism intervention, it is often better to build receptive conceptual strength before demanding expressive consistency. Many professionals I see, they do the receptive and labeling together. Of course, it works for few children, but the beginners, we shouldn't be doing that, because we have to make the foundation really, really strong, so that as they progress, as they grow up, as they start on the cognitive learnings, their skills are at place. Expression without understanding leads to fragile learning. Understanding supports the stronger expression. If you don't understand, you just say for the heck of saying things, it's different. And when you understand and you express, those are much, much stronger. Do use receptive checks before assuming expression equals the knowledge. Do observe how the child performs across. Sorry? Okay. Do observe how the child performs across the response types. Do build expressive language on top of the concept. That cannot be your base. Okay. Let's understand how the learning breaks. Steffi, next slide, please. How now a child may learn red only when shown one exact red flashcard on the same table by the same therapist. Child has learned red. Now this is not enough. Child may not understand redness as a concept. Child may only have learned a narrow association between one visual stimulus and one response. Every time you show that card, that's red. If I show the block piece, which is red, would the child be able to say red is red? Might not. Most probably not. Now, why this happens? Because of insufficient exemplar variation. We teach using one thing over and over and over again. Because teaching stayed fixed too long. Because generalization was not programmed. Because mastery was defined too narrowly. The child says this, I consider this as mastered. Now, how to prevent it? Teach red across the different red objects. Different shades were appropriate, different sizes, different contexts, different people, and both in receptive and functional task. If you are able to do that, child would be able to generalize red across his environment. Do not overgeneralize it too early. If the child has not yet formed the basic discrimination, excessive variation can be overwhelming. The key is structured variation, enough to build the concept. Not so much that the child cannot anchor only. Child like flows with the gun with the wind. No, we don't have to do that. Not overgeneralization, but we do have to have different stimulus to support the learning. What should we do? Do very exemplar after initial acquisition. Do test across natural materials. Do move from card to object to environment. Do use feature-based teaching in a systematic way. And then when you go back and cross-check, you will see whatever you have taught as a parent, as a professional, it's there with the child. Child is able to use that learning. What is the point of learning if you are not able to use it? Okay? Age relevant, of course, but child should be able to use in his daily life. What is the right order of learning? Steffi, next slide, please. What is the right order? Right order is the regulation first. If the child is having lots of sensory needs, lots of overstimulation from the environment, not able to regulate his or her emotions, movements, then it's difficult for the child to learn. So first we have to regulate, which is sensory integration basically. Then comes the receptive. After regulation, the receptive we have to build. Then we have to build discrimination. Then we have to build concept. From concept, we have to move on to expression. And from expression, we have to move on to academics. And this sequence is one of the most important frameworks in the session. So let's understand one by one what exactly it means. When I say regulation, a dysregulated child cannot learn effectively. Regulation includes emotional readiness, sensory balance, behavioral stability, basic attending, and the capacity to remain available for instruction. That means able to focus, able to listen to the instruction and act accordingly. This does not mean waiting for perfect calm. That doesn't mean that we will not teach till the child is able to lock hands, put it on the table, and wait for the instruction. Not really that. But once the session readiness is there, it means the recognizing that teaching must match the child's state. Whether the child is able to follow or able to follow the therapist. When therapist says, okay, come sit down on the table, sit on your chair, hands on table, whether at least to some extent child is cooperating or not. So in typical language we say compliance building. Next is receptive. Before expecting expressive or academic performance, the child must begin to understand. Now, receptive understanding includes orienting, selecting, giving, pointing, following simple instruction, and processing verbal or visual cues. Okay? Next is discrimination. Now, the child must learn to notice what makes one stimulus different from another. And this is the foundation for concept development. Without discrimination, everything remains blurred. We put the specs and we see clearly. If we don't have the specs, things are a little blurry. Because once we have the specs, we are able to see things clearly, we are able to discriminate, and we are able to develop the concept. Now, when we are talking, the next step is the concept. The concept emerges when the child can respond meaningfully across different settings and the context. Now, the child understands what makes a thing what it is. Okay? When that happens, when the child is, when I say fix the block, child is able to take the block and put the other block. Child has learned these are blocks and fixing means this. It's a concept. Child has built that. Next is the expression. Expression includes labeling, requesting, commenting, answering, all of that, and later the verbal participation in more academic formats. It's much later. Expression becomes stronger when it's built on concept. For example, if I say, what is this? A phone. What do you do with this? I talk on phone, right? And what's your father's number? Child tells me the father's number. So these are when the foundation, child has learned to identify the phone. That's a receptive understanding. In the presence of remote and the phone, though both are black, child knows this is phone. Child picks up the phone. Okay? Then there's a discrimination. The concept. Foundation of this concept development happens when the child is able to discriminate clearly between two objects and able to use it meaningfully across the different situation. Right? So now, next comes the expression. So, what do you do with this? I talk on phone. Then comes the academic. So, until or unless child has reached up to this level, if you introduce academics, it is not going to, child would not be able to cope with it. So, only now, when till the expression child has achieved, academic begins to make sense to them. Literacy, numeracy, early writing, comprehension, sorting by category, feature analysis, and the symbolic learning all depends on their earlier steps. Okay, so those are part of skill development, and here comes the cognitive development. So until or unless you have achieved the first part of it, do not move on to the second part. Do not rush into it. Maybe you look for a better teaching methodology, better way to give the proper stimuli to your child to understand better or learn better and implement the things better. Once that is achieved, move on to academics. Steffi, next slide, please. How to work. You have told about all the do's, don'ts, ma'am. You have told me about the steps. Now, how do I work? take micro targets. Micro targets are small, teachable, and measurable unit. Instead of saying teach fruit, we define specific target, such as identify apple from two choices, give banana on instruction, match identical orange pictures, or sort fruit versus non-fruits, label apple independently, find fruits in natural settings. These are your step to teach fruits. And now imagine we have at least 10 to 15 fruits. We have to go through all the targets like this. Now these micro targets are important because children with autism often need learning broken into clear components. Vague goals create vague teaching. Now I take a fruit basket picture, I say apple, banana, grapes, watermelon, and there's no precision. And you have to repeat it for longer, repeat it for more times. Instead, if you take micro targets, the learning happens faster. Next is structured mapping. Structured mapping means teaching in sequence logically. We do not randomly pick targets. We decide what should come first, what comes next, what prerequisites are needed, and how one program connects to another. For example, before asking for WH questions, WH questions are where are you, how are you, what are you eating, where did you go, how did you come, all of these. Before asking those WH questions in about the object or about the things the child has done, you have to understand whatever questions I told, child cannot answer if the child doesn't have object recognition. How did you come? I came by auto. Or just we expect the child to say auto. The child should have that object recognition. No? Then is receptive identification, feature awareness, functional association, and expressive labeling. And structure mapping prevents gaps. It doesn't let you have gaps in your development. So once you follow these, the learning of the child is rock solid. Next step is receptive to expressive. Now this is not a rigid rule for every child in every case, but it is highly useful principle. Receptive learning often provides a strong base for expression. Now, if a child can identify, select, sort, and understand, expressive use often becomes more meaningful and more stable. So, when I train my teachers or outside the professionals, I just tell them that take one object and try to talk to it. Talk to the glass of water without losing the relevance. Now, when that happens, what will happen? They are using their receptive understanding. What all do they talk about? Say, hey, glass, receptive identification. Oh, you have water in it, labeling. I love this shape of glass. I don't want to drink water, I want to drink juice in this glass. So you see, there's so many words they're using, and they are able to do this because they have words in their vocabulary. And receptive learning helps to build the vocabulary. Okay, that's why first we work on the receptive and then move on to the expressive. Now, the fourth thing is generalization. Generalization from day one. And when I say that, this phrase is very important. Many professionals wait until after mastery to think about generalization. and that is often too late. You should not make the initial teaching chaotic, but you should think from the beginning about how the skill will eventually transfer. And that, when I say that, this means planning. Different material, different person, different instructions, wherever it's appropriate, different environments, and natural use. So generalization has to happen from day one. What you shouldn't be doing, do not teach random content because worksheets are available. You have ready worksheets. I have taken this worksheet, so I have to teach this. No, it doesn't work for us as special educators, as professionals in the field where we are working. Ready worksheets are not for us. Ready worksheets can be used for generalization later when the entire category is mastered. Till then, we cannot use this. Do not advance to expression without analyzing receptive strength. Do not separate teaching and real life too sharply. The teaching is going this way, real life is that way. If there's no connection between these two things, learning will not happen. Because we know to learn, to be present, as all of you have joined this webinar because you feel motivated or you feel the need to learn something. If that connection is missing, now suppose you are here to learn about how the intervention program works and I start talking about how to build Lego, it's not relevant to you, even drop off. So it's important to have the connection between between the teaching and life. Life, when I say life, is the child's environment, the things child is exploring on a daily basis, things child is seeing on a daily basis. Once you start teaching through those, that's easier. Do not let data collection become more important than actual learning. It happens with professionals. They are busy in looking at the data, marking at the data, but please understand your focus. That doesn't mean I say don't take data down. Datas are also important, but actual learning, and at the beginning of the session I spoke about the meaningful learning, right? Please understand those two things are very, very important. The meaningful learning has to happen, actual learning has to happen, data will follow. Now, the next slide, Steffi. So, please understand, if you need child-based understanding, what you should be doing. This slide for professionals, it's basically the model for assessment and case formulation. For parents, it's a guideline. First and foremost, understand your child. This means do not start with a package. Start with observation, analysis. Look at the child's communication, attention, imitation, sensory profile, motivation, behavior, receptive language, discrimination, play, adaptive skills, and learning history. Once you understand all of that, you understand your child. Did I say reinforcement? If I think I have missed it. So, of course, the reinforcement also. The next thing is identify the gap. Child may not be behind globally in all the section, all the areas. But child may be specifically weak in discrimination, receptive processing, flexible responding, or generalization. Now, good intervention depends on identifying the actual gap. Once we are able to identify the actual gap, we are able to design a program, we are able to decide the targets which suits your child the best. And let's understand why. A professional, strong professional, does not just say what is wrong. A strong professional explains why it is happening. Now, for example, the child labels but cannot identify because expression was trained without sufficient receptive work. Now, the child counts but does not understand quantity because verbal sequence was taught without concrete numeracy. The child knows colors in therapy but not at home because generalization was not planned. Now, what we have to do? We have to give a roadmap to the families. Families and teaching teams need a clear roadmap. That roadmap should include current level, prerequisite gaps, teaching sequence, then the goals, and then what home carryover suggestions. And what are the indicators you should focus on or you should be able to identify to understand the child is moving ahead. Without that, if you try to, like whatever we do, it will be very incomplete. But in that process, please do understand that do not use jargons. None of the parent, no one around you, us rather, is interested to know how many difficult words can we use while explaining the problem. Please try to make it simple for parents to understand so that because everything can be broken down in a very easy way at a grassroots level. Try to break it down as much as possible as professional for the parent to understand. And parents, when you are looking at it, please go down to that level of the detailed task breakup. Do not say when professionals are telling you the jargons and you don't understand, please ask for explanation. It's absolutely okay to not understand. Do not blame the child or yourself as a parent. Ma'am, I gave the phone when he was small, so that's why he's not learning. Or some parents say, ma'am, I give the phone because he's learning from phone only. What is he learning? That rote counting, rote memories, typical repetition. Is the learning happening? No. So, do not create anxiety by listing deficits without a pathway. If you have a clear plan to share, then definitely you talk about the areas the child needs help. But if you are listing it down, then you should have a clear pathway for the parents. Okay? Do not oversell progress as professionals. Do not say, oh, I will fix this. I have done it in the past. Every child is different. And we as professionals know we need detailed study of each and every child to set the correct protocol, correct teaching method, correct prompt level, and the proper planning of feeding that prompt. So, as a professional, please do not do this. And if you need clarity, please reach out. How, Steffi, the next slide, please. If you need guidance, how will you understand this is the time I need guidance? Now, please understand, when you need a guidance, when the progress has plateaued for months, there was a up, right, and then it has become flat for many months. When the data is inconsistent across the settings, child is doing it here, child is not doing there, child is not doing there, all of that. When the child is responding but not understanding. When there is a strong prompt dependency. Child would say car, child knows this is car, you hold it and you have to say car, car, and child says car. These are strong prompt dependency. When parents and therapists report different skill level, therapist is claiming child is here, parents are saying child is here. It's not matching. That's when you need, as a parent, you need guidance. You need clarity. You need a roadmap. When programming feels random and repetitive, either the same targets, similar targets have been done, or there's a random thing is being taught. In both situations, you need a proper roadmap where the child has many responses but limited application. Child is able to respond but not able to apply it. Now, what a good guidance does, it clarifies the learning stage, it identifies the instructional errors, and it recognizes target flow. It improves fidelity and the direction, and it prevents burnout and the drift. When these are compiled in one guidance, that's when your journey becomes smoother with your child. Guidance, seeking guidance, looking for guidance, or having consultations, having going to the professionals after 6-7 years of the child's age, it's not weakness, because it's a part of scientific practice. If you are reaching out to professional for guidance, that means you are continuously monitoring your child's progress, and you know where your child exactly stands and what next a professional would be able to guide you through. Ma'am, we have been seeing this, we have been gone through this, we have been to many professionals, they said this, they said that. Okay, I completely respect the effort what you have put. I appreciate the amount of journey you have taken so far. But now you know, when you go, what are the exact steps you need to look at, what are the exact feedback you need to give to the therapist or the professional, and when they are giving you a guidance, what are the parameters you should look at to know whether that guidance is really good for you or not. Right? Ma'am, regulation you started with, you finished at generalization. It's a long path. Is it achievable? Next slide, Sophie. Is it achievable? What do you think? Is it achievable? Do you believe that your child can learn? If it's yes, please put a hands up in the chat box. Yes, your child can learn. We just need the right approach, scientific method. The statement, your child can learn, must be supported by method, not false hope, not vague reassurances, not pressure-based teaching, no endless worksheets, no performance tricks. The right approach. The right approach means it has to be assessment-driven, developmentally sequenced, behaviorally analytic measures, emotionally respectful, conceptually meaningful, and functionally relevant. For a 3-year-old child, I would not teach multiplication. That's not functionally relevant at all. What a scientific method means here. A scientific method means observe, hypothesis, teach, measure, analyze, modify, generalize, and maintain. And this is the scientific rhythm of good intervention. Now, wherever you are taking your child, whatever services you are taking, please go back and check whether these are there, and it's in the cities. If you want me to repeat once more, the scientific method means observe, hypothesis, teach, measure, analyze, modify, generalize, maintain. If that is not happening, then you need to look into the therapies. Children, I think mostly I have come to the end of the session. So as we conclude, please understand, child with autism do not only need teaching, they need the right teaching architecture. They need learning that goes beyond repetition. They need adults who understand the correct responding is only part of development, only one part of development. They need professionals who can look beneath the behavior, beneath the worksheet, beneath the table program, and ask the deeper question: what is the child actually understanding? When you become that kind of professional, your intervention changes, your goals become sharper, your data becomes more honest, your decisions become more ethical, your teaching becomes more meaningful, and the child's progress, that point of time, becomes more real. Always remember, matching is not meaning. Recitation is not literacy. Counting is not number concept. Labeling is not understanding. Table mastery is not life readiness. Your work is to help children to cross that bridge. So from response to understanding, from drill to concept, from prompt to independence, and from matching to meaning. Thank you. I'll take quick questions. Oh, I have taught really well, looks like.
Can give you 1 more minute. If you have any doubts, please feel free to ask question. She is pretty much ready to answer all the queries.
If it's child specific, I would say reach out to us. Uh, Here is
Yeah,
the
on the
number,
screen.
official number, or this to this email ID. But in general, if you have any question, you can ask.
I do have one question. I don't know if it's right or wrong.
Yeah, please.
If, like you said, if the child is at that plateau stage, and if we identify now that we as a parent we get some guidance from perseverance, the teachers they do their own curriculum, and we try our best. But in between these, should we also include therapies as an add-on from outside?
Oh, okay. So if you can just tell me what exactly, which area you're talking about.
So for example, speech, like if the child starts blabbering, he's trying to repeat what we say, he's trying to connect the dots, like you said. If I tell him to bring apple, he's telling apple, he's bringing the apple. So that is the stage, at least, where I have seen my kid, since I admitted him in perseverance, which is a good sign.
Right,
But there is a tendency, right? It's an itching, like if I put him in somewhere else, will it kind of boost him, or should I look into that route or not?
right. To answer your question, now please understand what happens in a speech session. First, you have to understand that when you put him for speech therapy, child goes at a fixed time for the therapy. Now, therapy takes target based on the baseline. Now, What if the child goes to that room, and usually typically the speech therapy sessions are in small rooms, and child therapist takes the card out and ask, what is this, tell me that. Now, whatever I have spoken for so long, the receptive, basically the therapist is working on, and you are sending him to school to work on the receptive areas as well. But how the school program is better than a therapy session, according to me, because here in the school setup, teachers are not working only at that point of time, or they don't have a fixed period to work on his speech. Speech is something which needs to be worked on throughout the day, and teachers are doing that. So opportunity for him to explore more, to learn more, is in the school setup. When I suggest personally for to go for additional speech session, when the child is having articulation issue, child is having oromotor muscle issue, which cannot be addressed by us, then point of time I say, yes, please go ahead and go and meet some OPTs. That is beyond our expertise. That point of time, if you put him, it works. Now, if you ask me, especially for your child, I would suggest whatever targets the teachers are working on, you can start doing those at home. And I think we have shared a home program now. If you focus on that, please, you will see a better result. Anyone else?
If there are no other questions, can I take one more, please?
Yeah, please. Go ahead.
Yeah. So, based on whatever I have seen, I have heard for the past near about 2 hours, in many places I can correlate myself doing that, but in some places I sense there should be some improvement on my side. But then I don't know. Maybe this is this answer to me as a parent rather than him. When we try something, sometimes we grab his attention and he tends to cooperate, and suddenly I get a feeling that yes, he's improving. But the same context, same subject, same object, then we don't know, right? Because since they don't speak, we don't know what is running in his mind. So if he doesn't understand, if he doesn't respond, he tends to get irritated or agitated. I get a feeling that yeah, it's like it's again he's taking one step down, and then I also get fed up and then I give a pause. So how do we trade off or understand, or how do we deal in those situations? Should we like, what is the best way to bring him to the normal state and then I can resume?
Okay. Now, see, when he's agitated, when he's resisting, that means you have started doing the thing at a wrong time. But if you just give up because he's agitated, because he's resisting, then there's a high chance that you develop a sense of escape also there. So just calm yourself down, just be there, tell him to calm down, say, okay, you are anxious, you don't want to do it, you have to ask me for it. So either you ask for a break, this is the sign for break. If he is not using the word, you can teach him the sign as of now. Along with, but please do not use only the sign, pair the sign with the word, say break, and he says, and he's trying to say all the words in the world right now. So let him at least put that effort, and he say, okay, I'll come back, and you let him go. Then you again later on or maybe you can just give him some preparation. Okay, Baba, okay, 10 minutes. I'm going to sit with you. The best way to do is in a very natural environment when you are playing. As a parent, we forget to play with our children. Trust me, when we play, they are at their best mood, and that point of time when you teach, they are really, really, coping the things. So if you look at perseverance also, as you are parent of perseverance, I can tell you, when you when children are coming, you will not say teachers are saying good morning, go to your class, which is a normal routine in typical schools, right? Here they accept the smile, then they interact little, so that kids are in happy mind, and in a happy mind they learn the best. If you try to discipline too much with your typical what how we were raised, then it's uh, yeah, it's not going to work with this generation, and it
Yeah.
doesn't work with the neurotypical child as well. Trust me.
Thank you.
Any more questions? So finally, Steffi had a doubt. I also had a doubt whether I would be able to finish it within five. I said, Steffi, I'm going to rush the first part because I want to talk about the intervention and the understanding part. So we did all of it, but yay, we have done it.
We did
We
it
have
on
finished.
time.
Yes, on time. Thank you very much, everyone, for joining. Uh, I hope to host more uh, a webinar in the future. If you have suggestion on the topic, please drop it in the chat box. I'll definitely consider those topics. Thank you.
So thank you so much, Dr. Suchismita ma'am, for such a insightful or meaningful session. And I'm very sure that it was very, really helpful to understand how we can move from just matching skill to, to build a real or true understanding skills in our children. And I'm sure all of us got a lot of practical ideas and how we can do step by step, and we got a clear perspective from all today's sessions, right? And thank you so much once again, ma'am, for taking your valuable time and sharing your knowledge from your experience with us. And thank you so much to all the participants who joined today and being a part of this webinar. And just to let you know that this recorded session will be available on our YouTube channel, which is Perseverance at Pregnia Charitable Trust. Repeat, Perseverance at Pregnia Charitable Trust. We also have other podcasts and webinars available there. So do check out them. And if you like, you can like, share, and subscribe and share with your friends and families. And for upcoming webinars and updates, please stay tuned to our social media platforms as well. We hope these sessions are was very useful to you. And everyone, have a wonderful evening today. Bye bye.
Thank you. Have a
Thank you
nice
again.
weekend. It's Sunday tomorrow, Steffi.
Yes, then have a nice weekend.
Thank you.
Thank you. Bye bye.